Welcome. In this explainer, we're going to break down the core procedures of phlebotomy, step by step. My goal here is to help you build your confidence and give you all the essential knowledge you need to walk in and absolutely ace your certification exam.
Okay, let's kick things off with the one principle that guides every single thing we do. This isn't just about following steps. It's a critical piece of patient care, where precision and safety are completely non-negotiable. When you get this right, you're not only protecting your patient, you're making sure the lab gets results they can trust.
So here's our game plan. We're going to start with the core principles, then walk through the standard procedure. After that, we'll get into special techniques for tough draws in kids, and we'll finish up with a rapid-fire checklist to make sure you're ready for your exam.
First up, let's talk about the 3 pillars of safe phlebotomy. These are the absolute must-dos, the rules you follow every single time to protect your patient, yourself, and the sample. I want you to think of these 3 rules as the absolute bedrock of your practice. Getting patient ID right prevents, and I mean this, potentially catastrophic errors. Putting safety first protects everyone in the room. And making sure that sample has integrity, well, that's what guarantees the lab can get an accurate result. You master these 3, and you'll avoid the biggest mistakes you can make.
All right, let's get into the nitty-gritty of the procedure you'll be doing day in and day out, venipuncture, using the evacuated tube system, or ETS. We're going to go through this from the very beginning to the very end.
You know, the setup is so incredibly important. Look at everything that happens before a tourniquet even comes out. You're checking the order. You're getting every single piece of equipment ready. You're washing your hands. And then the big one. You positively identify that patient with 2 identifiers. And please remember this. You never, ever pre-label your tubes. That is a huge safety no-no.
Okay, the most crucial thing on this slide is that 1-minute mental clock for the tourniquet. If you leave it on any longer, you can cause something called hemoconcentration, which basically messes up the test results. And when you're looking for a vein, always feel for that bouncy median cubital first. It's usually your best bet.
Letting that alcohol air dry completely isn't just about being nice to the patient. It actually prevents hemolysis, which is when red blood cells burst. And the second you see that beautiful blood flow into the tube, pop the tourniquet. That simple little action is one of the best things you can do for sample integrity.
Okay, I need you to really focus here, because this will be on your exam. The order of draw is a strict protocol, not a casual suggestion. It's all about preventing the additives from one tube from messing up the sample in the next tube. You have got to commit this sequence to memory.
2 really key actions here: gentle inversion and activating that safety device. You have to invert the tubes to mix the additive in and prevent clots, but if you shake them, you cause hemolysis. And activating the safety device with one hand, right after you pull the needle out, is a major safety rule to prevent needlestick injuries.
And this right here is what we call closing the loop. You started the whole process with patient ID, and you end with it, labeling every single tube right there at the bedside and then reading it back one last time against their wristband. That's your final safety check. It's how you make sure the right results go to the right person.
So, not every vein is going to be a perfect, easy draw. Now we're going to look at how you can adapt your technique for those smaller, more fragile, or just plain tricky veins by using a butterfly or a syringe.
When you switch to a butterfly set, there are 2 major differences you have to remember, especially for your exam. First, your angle is much shallower. And second, you must use a discard tube if you're drawing a light blue top first. Why? Because that little bit of air in the tubing will cause the tube to underfill, and that ruins the sample.
The syringe method is all about control. It's perfect for those really delicate veins that might just collapse under the pressure of a vacuum tube. You get to control the flow by pulling back slowly on the plunger. But, and this is a huge but, after the draw, you never, ever push the blood into the tubes. You use a transfer device and let the tube's own vacuum do all the work.
Look, it's gonna happen. Sooner or later, every phlebotomist has a draw that just doesn't work out. The key is not to panic. A real professional has a plan for what to do next, a plan that is structured, safe, and always puts the patient first.
So, you've done everything by the book, but you missed the vein. Or maybe it rolled or collapsed. What now? What is the professional, rule-based approach for your second try? What do you change?
This is your guide for a safe comeback. Just remember the 1 change rule. It's simple. If you're going to try a second time, change 1 key thing. Don't just poke around in the same spot. Try the other arm, or maybe switch from a straight needle to a butterfly. And remember, most places have a policy that after 2 tries, it's time to ask a colleague for help.
And here's a massive red flag, both for your exam and for your career. Just trying the exact same failed method again? That's not just a bad idea, it's considered unprofessional and unsafe. You're just increasing the risk of hurting the patient without actually solving the problem.
Okay, let's shift gears and talk about our smallest patients. Working with kids requires a ton of skill and extra vigilance. The margin for error is tiny, and the responsibility is huge, especially when you think about the total amount of blood you're drawing.
This number, 1%, is so important. For a tiny premature baby, a single blood draw should never be more than 1% of their total blood volume. If you go over that, you can cause something called iatrogenic anemia. That means the medical procedure itself is what made the baby anemic.
This table might look like a bunch of numbers, but the message is really simple. Every single milliliter counts. What seems like a tiny amount of blood for an adult is a huge percentage for an infant. You always have to know the safe limits based on your patient's exact weight.
These are the classic mistakes that you'll definitely see questions about on your exam because they directly mess up the quality of pediatric samples. Underfill a tube, and the additive ratio is all wrong. Forget to invert, and you get tiny clots that will get a sample rejected every time.
So, to wrap up this really important section, just remember the formula for pediatric success. Gentle technique, the right equipment, very little tourniquet time, and being super strict about tracking the volume to keep your patient safe.
Okay, we have covered a ton of information. Let's finish up with a super quick, rapid-fire review. These are the absolute must-know rules for you to succeed on your exam and on your first day on the job.
First and always, ID your patient before you stick. 2 identifiers every single time.
Remember, the order of draw isn't a suggestion, it's the law. It ensures valid results. You gently invert tubes to mix them. You never, ever shake them.
That tourniquet, 1 minute max. Start a clock in your head as soon as it's on.
And labeling, that only happens at the bedside. Never walk away with an unlabeled tube.
And finally, safety first. Click that safety device into place immediately. So now you have the tools to perfect the technical side of things. But mastering the skill is only half the battle. The other half, the real art of phlebotomy, is earning your patient's trust with calm, confident, and compassionate care. That's what turns a procedure into a positive experience. Good luck on your exam. You've got this.